Hello, I'm deeply concerned about the advice being given to the government about a strategy for containing coronavirus based solely on social distancing. At the World Health Organization, where I used to work, the strategy is to test all over the country, to trace contacts, to quarantine them all, and to have a social distancing policy, and to do all four of those things as quickly and speedily as possible. Here's our Deputy Chief Medical Officer speaking 2 days ago.
The first one about the WHO comment. So I think the comment you were picking up was Dr. Tedros saying test. But in fact, we need to realise that the clue for WHO is in its title. It's a World Health Organization, and it is addressing all countries across the world with entirely different health infrastructures. So the point there is that they are addressing every country, including low and middle income countries.
She seems to suggest that the World Health Organization policy is only for poor and middle income countries, and that our public health system is well capable of making surveillance happen. But I fail to see how a public health system can be any way functional if it has no access to tests and no community surveillance system. So let's look at the figures from a comparable country, a high-income country, Korea. Korea has death rates, now that their epidemic is largely suppressed, of 3 per million population. In the UK, we're already 6 times higher. And if we went up to 10 or 20,000 deaths, which one government advisor said would mean we were doing well, then we would be 100 times higher than in Korea. Now look at the distribution of their cases, 80% of them in 2 areas, and the distribution of deaths, more than 90% in 2 areas. So we have hotspots and low-intensity areas. In the UK, clearly London and the West Midlands are hotspots, but in many parts of the country, we have less than 10 confirmed cases in at least 50 local health authorities. So I believe we should be testing and contact tracing and quarantining as well as social distancing in these areas. In Korea, they set up 71 testing centres for the country. When we stopped community testing in the UK 2.5 weeks ago, we only had 3 public health laboratories doing the tests. There are now plans to scale up to 8 laboratories, but this is going to focus mainly on hospitals and on health workers. That is a good policy for hotspot areas, but in low-intensity areas, we must maintain surveillance. I'm worried that we won't know about the spread of this virus into low-intensity areas. I'm worried that we will have new outbreaks, and I'm worried that we won't have a surveillance and testing system up and running when we want to lift the lockdown in a few weeks' time. I'm really fearful that without a comprehensive WHO policy, and the UK is out on a limb here, we will prolong the epidemic, we will slow suppression, and it will eventually cost lives. I believe that we must scale up testing in communities as well as hospitals as quickly as possible.